This is our patient Alan. Alan has had knee surgery a while ago, and we're going to just do a quick evaluation and see what he has. He also suffering from low back pain and anything else?
General anxiety.
Alan, how does that feel compared to that?
Same.
That?
Same.
Okay. Do you hear this more in one ear versus the other?
Yeah, this one's always clogged up.
See something. Push up. Try again. Go. Okay. Push up for me. Good. Push up. So we have no strength on the right. Obviously, we have a right knee surgery that's still inflamed. Alan, push out for me. Good. Push out. So we have no strength on our right lower extremities. Actually, bend this knee. Pull towards your head. Good. Can we do that in this leg?
I think so.
Don't let me pull. Okay, so we have no strength on the right side whatsoever. Push towards my nose. Good. Push towards the camera. Okay, so all of our right-sided muscles, don't let me pull, are inhibited. So right now we're going to do some right-sided cerebellar therapies, right-sided adjustments, right-sided trigger points, and probably do some right-sided mobilization on his cervical spine. While we're going to do some right-sided adjusting and cerebellar exercises, we're also going to look at the left side, left cerebellum, right brain, right tone, right hemisphericity for right tone, and see if that causes an increase in strength in his right side. And then we're going to have Alan walk and check to see if his pain is diminished and if he has a little more coordination with the less trepidation when he walks. Alan could not resist with his last test. He can now. Flex withdraw reflex. Push up. Better. Push up. Even that test. Try this one again. Push out. Alan, don't give up. Go. Better. Did it hurt? Does it hurt the same or?
It didn't hurt the same.
Okay, so it is different.
It is different.
Great. Thumb down. You push that way. Nope, just that one. Go. Oh, good. Okay. I'll make a left fist. Push that way again. No, you relax. Make a right fist for me. Open this hand. You push that way. Nope.
The other way.
Okay, you rest. Nothing sudden. That's all we're going to do. So we're going to do a right-sided cerebellar exercise with some right-sided adjustments.
I remember watching you do this on patients.
Alan's been with me 4 or 5.
Something like that.
4 or 5 years, 6 years maybe, in my continuing education classes. One year we went up to Taft, Botanical Gardens in Ojai.
That was fun.
That was great.
It's probably all burned up.
I was going to say, it probably
You'd be
is.
surprised. That was really fun. One of the best CEs I ever went to. Yeah.
Did you get warm?
As a matter of fact, I did. You know, I was going to say I feel warm before you said that.
I Second. Alan, try this one, push up. Good. Try this one, push out. Good. Alan, let's go get you to go up and down the steps again and see if your legs feel any different.
Okay.
How's the legs feel?
Pretty good, pretty loose. It always hurts going down steps. Right here is where
Now on your knee or on the right knee when that happens?
right here it starts hurting.
But you talked about your quads being tight. Do they still feel tight?
Yeah.
Do you have a change in strength maybe? Let's have you go back up and see what you got. How do the legs feel strength-wise?
Well, normally I would go up this way to keep it straight, but I've been going like this. It feels a little better, yeah, looser. See, you know what's amazing about you is you'll say, let's go see how it is after we did this. Let's go out and walk. Nobody does that.
Well, you know what
there
it is?
isn't a doctor I know that does. Let's go outside and walk. Check it out. Nobody does that.
You know what it is? It's my automotive days.
Automotive.
Yeah. You know I was a mechanic, right?
Well, what kind of mechanic?
Car mechanic.
You mean like tune-ups and stuff?
Yeah, I did.
I didn't know that.
You have that picture over there.
Oh my God, I see it. Oh, you really were a mechanic.
Yeah. So the reason that's a big deal
Oh my God.
is
You did engines as a mechanic?
Yeah.
Oh my God.
That's old school mechanics when they actually matter. Why is that have any impact on my practice?
Well, it's obvious when you're done fixing a car, you drive it.
Exactly. You got it.
And you're going to drive me to see how my
Exactly.
what effects I have. Yeah, but you're the only one I've ever in my life seen do that. I've been practicing for 41 years, and I go back with some of the old chiropractors, all dead now, that were really pioneers, like William Wolf Adler, and they never did that.
Well, they were mechanics.
Record of saying, to me, Mark Algie's my therapy. Yeah.
You push up. Good, I like that. Push up. I like that. Alan, push out. Ooh, I like that. How's it feel?
Definitely, without a doubt, stronger.
Yeah.
Not even a doubt. And I'm waiting to see if you're doing it less or harder, to see if I'm controlling it, and I'm actually stronger.
Pull towards your head. We're going to fix that still. It's better, but it's not perfect. Let's do this.
And I ripped my biceps tendon 2 years ago, and ripped it good. All of that medial aspect was all black and blue.
Did you ever get, what was the rehab? Did you do the...
Oh yeah. Yeah, that, I can show you the actual muscle that hurts like hell. It's not the biceps. I don't know which one it is.
Thank you for your patronage and friendship.
Oh. Are you on the long head or the short head?
I'm on A head.
Yeah, I can't tell sometimes. Oh.
Try to relax. I know that's tough.
Yeah, that hurts. I can't, the coracoid is one end. Oh, you're digging around, are you? Oh, man.
So the reason we're doing Alan's pecs and his biceps is he talked about a tear, and we also want to stimulate right-sided cerebellar inputs. So we're going to do some massage on these tissues. His right hip flexor, which was stronger with our second test, was a little spongy, and I could see if we continued to test it, it would fail. And remember, the right cerebellum feeds into the left red nucleus, which feeds back into the right hip flexor. Relax. And I also don't want to make Alan too sore. It's probably the first time. When's the last time you actually had massaging your pecs?
Probably 25 years ago.
Okay. Alan, try this. You ready?
Yeah.
don't let me pull. One more time. Again. Okay, it's getting a little spongy. We're going to let you rest.
Appreciate your expertise here.
Well, you're not paying for a second-rate chiro, are you? You're not going to some other.
I don't go to anybody else. To make you happy, I'll tell you, they're all dead, the ones I've been going to.
Forgive me.
Oh, that's smart.
So we're doing as adductor longus, brevis, and magnus here, because these are all muscles to support the knee.
Yeah.
And since we want him to have that strength when he does that up and down the steps, we're hitting the gracilis and some of the glute med attachments. I'm probably not going to put this in the video because it looks a little too gay, you know. Not that there's anything wrong with that. Don't pull. Good. Again. Good. Again. Good. One more time. I like that. We're going to let you rest, okay?
Yeah.
There's many different styles of chiropractic. Is that doctors doing this style of chiropractic cannot see 40, 50, 60, 70 patients. It's not possible. Not only could you not do the energy transfer, you don't have the time. Just the physical component of time is missing. So when we look at a patient's body, we check them out, we look at all their injuries, all their past structural deficits, whatever past injuries or traumas or incidents that took place, and we test drive them. So we're going to have Alan go test drive his vehicle here in a moment by going back down the steps and back up. And we're going to see if he has a decreased pain and greater ability to control his body with that movement. And we're going to see if we can minimize some of the pain in his knee. I can also feel his temperature went up. Temperature, as we know, is an indication of relaxation. It's also when we stimulate the brain, and the brain gets stimulated, we also stimulate some of the peace centers, which causes vasodilation. And when you get vasodilation, you get more blood flow, and with more blood flow carries more heat. So we're doing a simple mobilization and just helping assist the joint to the range of motion. As always, we're checking to see if the patient's increase in perspiration took place.
Good.
Push down. Leg straight on this one. Go. Good. Now bend this knee. Don't let me pull. Wow. Go. 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 You feel it?
Oh yeah.
Pretty rock solid.
Solid. I wasn't joking. I mean, it's rock solid compared to the first. That's due to good. You're a good practitioner. Okay.
We'll let you rest for a second. I'll let you get lightheaded.
That feels better. Feels stronger, actually. The word stronger. I still feel it pulling, but it's strong. Yeah.
More grip strength a little bit in your legs?
Without a doubt. Less pain going up, that's for sure. Yeah. This hasn't felt this good since the damn surgery, if you want to be honest about it.